Welcome to the Principle of Public Health Management. Management and leadership are two sides of the same coin. Both are equally important skill sets to run an organization, to lead a vision, and to accomplish a public health mission. Management consists of controlling a group or a set of tasks to accomplish a goal. It is managing work on a day-to-day basis. Leadership involves influencing, motivating, enable others to contribute toward organization, goals, and mission. Leadership involves leading people to understand and to see the same vision of the leader. Both a manager and a leader needs a plan. It is like a map that details the process of the activities, the roadmap, and the goal to accomplish the mission. The vision communicates what your organization believes are the ideal conditions for your community, how you want to achieve your mission. The vision statement encompasses the belief, the principles, the philosophy that governs your overall arching goals, activities, and day-to-day tasks. The mission statement is the what and why. Developing mission statements are the next step in the action planning process. The mission statement describes what the organization is going to do and why it's going to do that. Mission statements are very similar to vision statements. However, mission statements are more concrete and they are action-oriented than vision statements. The vision statement is a broad philosophical ideal that governs the mission statement. Once the mission statement and the vision statements are accomplished, the next step is to have a list of goals, which are the desired outcome of the organization to envision to achieving the mission statement. How are goals different than mission statements? Goals can be defined by this acronym, SMART. Are these SMART goals? Is it specific? Is it measurable? Is the goal attainable within reasons, given the resources? And is it realistic, given the time frame? And is it timed? Is there a specific deadline in achieving these goals? As we read the article focused on the Healthy People Goals for 2020, keep in mind the mission statement, the vision statement, and the goals that the U.S. was trying to achieve. Did we achieve what we aimed? And what were the gaps? What were the barriers? And moving forward, as you become public health leaders, what do you want to see as the next 2030 goals? The vision was to have a society in which all people live long and healthy lives. The mission statement was to identify nationwide health improvement priorities, to increase public awareness and understanding of determinants of disease, disability, and health. The mission was also to determine measurable objectives and goals as applicable at a national, state, and local level, to strengthen policy and improve practice that are driven by evidence, and to identify critical research, evaluation, and data collection needs. These were the mission statements of 2020 Healthy People. To find the overarching goals of the Healthy People 2020, let's visit Table 4 in your assigned reading. In this table, you will see a column on the left that illustrates the overarching goals. There's 4 main goals, and in each of these goals, they define the measure of progress. We had just covered that goals need to be SMART. They need to be specific, measurable, attainable, realistic, and time. If you look on the far right, there's a column that's designated as the measures of progress. They were SMART goals. They defined the progress by identifying the life expectancy, healthy life expectancy, activities, chronic disease prevalence, and the list goes on and on. They define whether they achieved these goals by identifying whether they met these measurements. The first overarching goal of Healthy People 2020 was to attain a high-quality, longer life free of preventable diseases, disability, injury, and premature death. The second goal is to achieve health equity, eliminate disparity, and improve the health of all groups. The third goal is to create a social and physical environment that promotes good health for all. And fourth is to promote quality of life, healthy development, and the healthy behavior across all life stages. My question to you is, how well did we do? Pick a specific public health area that most interests you. Is it maternal child health, HIV, chronic diseases, diabetes, heart disease? Pick a topic and dive into the literature. Search on the web. Go to the CDC website, the WHO website, CNN Health, Times Health, any news outlet. I want you to look at how we are doing right now. See if you're able to identify the measure of progress in these news outlets. What does the statistics tell you? What do the media tell you? How does the community feel about how well they're achieving the 2020 Healthy People goals? I know this is a long list of diseases that you can choose from and it could be difficult, but just for practice, pick one public health topic and pick one of the goals, one of the four arching goals of Healthy People 2020, and see if they were able to achieve that goal. Were they able to achieve the measure of progress? On the left column, you will see a list of different indicators. Choose one. With this indicator, use it as a measure of progress of how well they were able to achieve this particular goal toward your public health interests. In addition to learning the basic concepts of management in this class, I want you to have this opportunity to apply what you learned in this class in accomplishing your public health interests. This is the first stage in preparing leaders in public health. In the second article, Preparing Leaders in Public Health, it gives you a glimpse of the new direction of leadership skills that's necessary to lead the mission of public health and social justice, to form a more collaborative approach in solving public health issues into practical application, and to have the courage to become a disruptive innovator, to use technology, social media, in driving change. And last, to have a new mindset beyond basic management skills, to be able to plan, organize, control, and lead a group toward their own vision. In our complex world with many different stakeholders, a leader needs to be political, savvy, and tactful in the way they deliver their leadership. And I like to add that you stay true to your own vision. As you read these two articles, think of this question: what kind of leader do you want to be? See you on Blackboard.